Imagine a patient loses a lot of blood and heart keeps pumping, but where does every drop of blood coming back from the body enter first? Not the ventricle, not the left side, and it first enters the right atrium. If you understand the right atrium today, you will automatically understand the blood flow throughout the heart and the location of SN node and many important anatomy questions asked in university exams. Right atrium is one of the favorite university exam topics and students are commonly asked external features and internal features Sulcus Terminalis and Crista Terminalis. Fossa Ovalis, yes and no location. If you understand the logic behind these structures, you will never have to memorize it. So first of all, what exactly the right atrium? The right atrium is the upper right chamber of the heart and its main job is very simple. It receives deoxygenated blood from almost entire body and sends it to the right ventricle through the right atrioventricular means the tricuspid wall. Think of the right atrium as a waiting room at the railway station. Passengers first gather in the waiting room before entering the train, and similarly, venous blood first collects inside the right atrium before moving into the right ventricle. From the body to the right atrium, then tricuspid wall, and then the right ventricle. Let's see the position and function. The right atrium forms the right border of the heart and contributes to part of the upper border. Its function are to that receives venous blood from the whole body and pump that blood into the right ventricle through the tricuspid opening. Simple. Receive and then pump. External features. Now let's study. Feature first, that is shape. Right atrium is elongated vertically and its upper end is receives superior vena cava. At the lower end, it receives the inferior vena cava. So remember, SVC is above and IVC is below. Right auricle, but what is the ear-like projection is there? This is called as the right auricle. Think of it as a small expandable pouch that increases the capacity of atrium. It extends forwards to the left and it covers the root of ascending aorta and partly overlaps the infundibulum of the right ventricle. Its inner surface is sponge-like because muscular ridges that we will study later. Third one is the sulcus terminalis. Now notice this shallow groove running from the superior vena cava to the inferior vena cava. This groove is called as sulcus terminalis. Here's the interesting part, that is this groove is present outside the heart. Inside the atrium, it corresponds to muscular ridge called as crista terminalis. And students often confuse these two, that sulcus is outside and crista terminalis is inside. Next feature is SA node. That where is the SA node? The natural pacemaker of the heart. It lies on the upper part of the sulcus terminalis, close to the opening of the superior vena cava. Because electrical impulses start here and SA node is called the pacemaker of the heart. If SA node is damaged, the heartbeat becomes abnormal and then patient may require any artificial pacemaker. Feature fifth is right and atrioventricular groove. Another important feature of the right atrioventricular groove, that it marks the boundary between right atrium and right ventricle. And it more importantly, it lodges two important structures, that are right coronary artery and small cardiac vein. This is another favorite Viva question. So now the question is, which vessels bring blood into the right atrium? There are six important inlets are there: superior vena cava, inferior vena cava, coronary sinus, anterior cardiac veins, vena cava minimi, that is Thebasian veins, and sometimes the right marginary vein. Instead of memorizing them randomly, think of them like as a body sends blood through the SVC and IVC. Heart muscles drains through the coronary sinus, anterior cardiac veins, and Thebasian veins. That makes the list much easier to remember. Here is the memory trick for this, that yes, I see AVM like superior vena cava, inferior vena cava, coronary sinus, anterior cardiac veins, venae cava minimi, and sometimes marginal veins. Sometimes. So we will study the next part, that is the right atrioventricular orifice. Before studying the walls, let's look at the exit of the right atrium. This is opening called right atrioventricular orifice. It's also called as tricuspid orifice. It connects the right atrium to the right ventricle. Blood flows through these openings into the right ventricle, but here's the important question: why doesn't the blood flow backwards? Because this opening is guarded by the tricuspid walls. This wall allows one way of the blood, and clinical question is that the damage to tricuspid wall causes the tricuspid regurgitation, allowing the blood to leak back into the right atrium. Internally, the right atrium is divided into three parts. There are the internal features. First one is the smooth posterior part called as sinus venarum. Rough anterior part is called as pectinate part, and third part is interarterial septum. The smooth area is called as sinus venarum. This smooth area is called as sinus venarum. And why is it smooth? Because embryologically it develops from the right horn of the sinus venosus. This is favorite university question, and most veins entering the right atrium open into the smooth part. Then the superior vena cava opening at the upper end. Superior vena cava opens into the sinus venarum. Notice something important, that there is no wall at the opening of the SVC. Blood simply enters the atrium. Inferior vena cava opens at the lower end. Unlike the SVC, its opening has a small fold called the eustachian wall. Now you may ask, if it's called the wall, does it stop blood flow? No. In the adults, it is only rudimentary structures with almost no function. But during fetal life, it had an important job. It directed oxygen-rich blood coming from the IVC towards the foramen ovale, allowing the blood to pass into the left atrium. Let's see the coronary sinus opening. Just below the IVC opening, there is important opening, that is the coronary sinus. The coronary sinus collects the venous blood from the heart muscle itself, and its opening guarded by the small fold called as the Thibetian wall. Remember the difference? IVC has the Eustachian wall, and coronary sinus has Thibetian wall. Venae chordae minimi. But does all the venous blood from the heart passes through the coronary sinus? No. There are numerous tiny veins called venae chordae minimi, are also known as the Thibetian veins. These tiny veins are present in all four chambers of heart. Instead of joining the coronary sinus, they open directly into the right atrium through the minute openings. These veins explain why the small amount of deoxygenated blood normally mixes with oxygenated blood inside the heart. Intravenous tubercle. Now look at carefully at the posterior wall. Here are the tiny elevations called the intravenous tubercle or the tubercle of floor, and it's very small, may be even difficult to identify. During fetal life, it helped to direct the blood from the superior vena cava towards the tricuspid wall and right ventricle. In adults, it has the little functional importance. Let's see the rough anterior part called as the pectinate part. This rough anterior part, including the right auricle, is called as the pectinate part. It develops from the primitive atrium. Unlike the smooth posterior part, now notice these parallel muscular ridges. These are called as musculi pectini. These are the musculi pectini. These are the parallel muscles. Rough anterior part, musculi pectini. These are called muscula pectini, and word pectinate means the comb-like. Just like teeth of the comb arranged in parallel, these muscular ridges run forward and downward from the Crista Terminalis toward the tricuspid orifice. Inside the right auricle, these muscles branch and interconnected to form reticular network. Why are these muscles present? They help the atrium to contract efficiently without making wall very thick, and it's excellent example of how the body increases strength while keeping the chambers light. Crista terminalis. It is the remember the sulcus terminalis we studied in outer surface. Inside the atrium, it appears as a muscular ridge called the crista terminalis, and ridges separates the smooth posterior part from the rough anterior pectinate part. Students often confuse these two, that sulcus is outside and crista is inside. This is crista terminalis inside and outside. Outside is not here showing here, but Inside is Crista Terminalis, and behind that, Sulcus Terminalis. Now let's move on to the most important structures of the right atrium, that is interatrial septum. Here is interatrial septum. This wall separates the right atrium from the left atrium, and can you see the shallow oval depression? This is called the Fossa Ovalis. It is one of the favorite university exam questions, but why is depression is present? Because during fetal life there was an opening here called as the foramen ovale, and after birth, when the baby starts breathing, the opening normally closes and depression left behind called the fossa ovalis. Limbus annulus of the fossa ovalis. The surrounding fossa ovalis is raised ridge called the limbus or annulus of the fossa ovalis. This prominent margin represents the lower free edge of the septum secundum during the development. So remember, the fossa ovalis is the floor and limbus raised border. Patent foramen ovale, that is the normally foramen ovale closes soon after the birth, but sometimes it remains partially open, and this condition is called as patent foramen ovale. PFO. Instead of complete closure, small slit-like opening persists between the upper part of the fossa ovalis and its limbus. Many people with the small PFO have no symptoms. However, in some patients, it may allow abnormal passage of blood or even small blood clots from the right side to the left side of the heart, increases the risk of stroke. When the examiner asks the embryological significance of fossa ovalis, always mention that it is a remnant of fetal foramen ovale. Now we will see the one important here is theory about the foramen ovale and annulus ovalis, limbus fossa ovalis, and here we have seen all about the right atrium. Here is one MCQ for you, that which structure separates the smooth posterior wall from the rough anterior wall of the right atrium? That is, the answer is Crista Terminalis. Not a sulcus terminalis, it's Crista Terminalis because it's present in the inside. So congratulations, you have now understood the right atrium completely, from its external features to its internal anatomy and embryological development and clinical importance. If this lecture has helped you to understand the concept and memorizing it, thank you.